morning. I'm Dr. LaQuandra Nesbitt, and I'm the Director of DC Health. And this morning, I would like to welcome all of you on behalf of Mayor Muriel Bowser to our inaugural Health Equity Summit. The conversations that we have today will center health as a core component of planning for community stakeholders as we work together to build a roadmap to an equitable post-pandemic future. I would like to acknowledge and thank Dr. Anneta Arno and the Office of Health Equity team, as well as Dr. Amber Hewitt and the Office of Racial Equity team for coordinating this event, and welcome all of our amazing speakers and panelists who are joining us today, both virtually and in person here at DC Health. Before we begin, I would like to pause for a moment of silence to remember those we have lost to COVID-19 in our community and globally, and other diseases that have so disproportionately affected communities of color. It's because of these inequities in our systems that we are here today, and I believe it's important for us to take time to remember those we've lost in order to inspire us to create a better future for those who will come next. Thank you. In February of 2019, DC Health released the Health Equity Report for the District of Columbia. This document was meant to serve as a starting point for a district-wide conversation about how we can better understand and work together to solve our health equity crisis. One of our conclusions was that only about 20% of our overall health as a community is determined by the clinical care we receive. The truth is that opportunities for health are driven by a broad spectrum of societal, structural, and institutional laws, policies, and practices, ranging from housing to employment to education. Today's event is one of our key initiatives to engage different partners and address the racial, geographic, institutional, and financial barriers that have led to disparate health outcomes across communities. By looking at different areas of health and working together with experts, government policymakers, and you, the public, we can generate a collective impact that will improve the health of all district residents in a way that provides everyone the same opportunities for a healthy life. I believe strongly in bringing our communities together with our health leaders, policymakers, and experts in order to foster an open and honest dialogue and build trust in one another as we work together to identify and move forward, eliminating health inequities in the district. I want to thank all of you again for being here, and now I'd like to introduce Dr. Anneta Arno, Director of the Office of Health Equity here at DC Health.
Good morning, everybody. My name is Anneta Arno, Director of the Office for Health Equity here at DC Health. It is my pleasure to work with all of you today to launch this summit and to have this candid conversation that Dr. Nesbitt mentioned. Thank you so much to all of you for joining us. My special thanks to the Summit Planning Committee, who have worked tirelessly to put this together over the last several months and weeks, and to the Mayor's Commission on Health Equity, who have long discussed having such a summit where we engage all of our community to talk about this problem that we've been challenged with for far too long. The entire DC Health team has really been critical to actually having this day get launched. From the executive leadership team, led very ably by Dr. Nesbitt, whose vision it was to launch the Office for Health Equity in the first place, all the way through to IT and facilities, and everyone at DC Health is really what I call the work behind the work. Finally, as we gather today, I want to remind us about the very thoughtful words of Dr. Martin Luther King, who in connecting us with the present and the past as a starting point for connecting us to the future. What he said was, we may have come on different ships, but we are now very much on the same boat. As we call to mind our individual and collective journeys and ancestry, it is important that we understand and be mindful of the long-standing history of the land on which we stand, and to seek to understand our place in this history. Please join me, therefore, in acknowledging that we operate as DC Health on the historic homeland of the Nakatan Anacostian, and Piscataway peoples, and honor with gratitude the land itself and the people who have stewarded it throughout the generations. Thank you so much for joining me, and now I'm going to do very quickly, give you a very fast run through. Dr. Nesbitt mentioned framing the summit. Why are we having this summit today? We all know we've gone through a whole pandemic, and while we're not out of the woods yet, it is time for us to start thinking ahead. The Health Equity Report 2019, which we'll show in the next slide, actually tells us about the 9 key drivers of health. The next slide, which will actually tell us about what was in the report and what was unique about it, is that beyond those 20% that is really in the healthcare space, traditionally, are what we call the 9 key drivers of health: education, employment, income, housing, transportation, food environment, medical care, outdoor environment, and community safety. What we've done specifically in the Health Equity Report is to drill down below the traditional ward level and to think about our district in the terms of 51 statistical neighborhoods. We also correlated all the data in relation to life expectancy at birth, and we actually looked through the lens of not just social, but the structural determinants of health. Anyway, so if you want to think about it, just to reinforce this idea of the 2080 of non-clinical determinants, there are key ideas that we need to think about in terms of insights. Health is more than healthcare. Health inequities are neither natural nor inevitable. Your zip code may be more important than your genetic code for health. The choices we make are shaped by the choices we have. And structural racism acts as a force in the distribution of opportunities for health. What this means, therefore, is that all policy is health policy. Bottom line is, before the pandemic, what we found was that there was a 21-year difference in life expectancy at birth in the district across the 51 statistical neighborhoods. And that shows in the bright red on the top northwest of the city. And you can see in the graph on the left that while some neighborhoods have a life expectancy of nearly 90 years, others are below 70 years. We also know that what we should be doing as we move forward, and the summary that we came from the Health Equity Report, is that there are differential opportunities for health across the city. We also know, as I talked about earlier, structural racism acts as a force. We really have a situation where even though we've gone through many years of having laws that in theory provide everyone with equitable opportunities for health, we live in a highly segregated city where we would have nearly 70% of us would have to move if we were to get an equal distribution of all of us by race and ethnicity across the city. This is not to say that that is what I'm recommending, but it's just letting us know that we're actually living relatively close to each other, but living and experiencing the district in quite different ways depending on where we live. Bottom line is that what we have are differential opportunities for health in the district across these 9 key drivers for health. And so summarizing, we have the 21-year difference. We know that for some places in the city, the opportunities are not as great. The opposite is true. They have lower life expectancy and fewer opportunities. And overall, it is clear that there are differential opportunities for health by income, place, and race. The solutions that we advocated for were collective actions that we all need to work together because health equity is everybody's work. So, starting off, what we did was we now find ourselves, a pandemic came along, and we have had to work tirelessly here at DC Health in collaboration with all the citizens in the city to try to get past the pandemic as we've done. So what we're going to do today is really think about how we have been planning here at DC Health and leading our city as the chief health strategist for the city in terms of moving past the pandemic. A good way of thinking about this is to think about the post-pandemic legacy and a 3-legged stool. We really need to think about access to quality health care, the social and structural determinants of health, and structural and institutional racism. Next slide. And now what we know is that the Post-Pandemic Recovery Report, which was published in May 2021, actually covers a lot of what we need to be thinking about in the healthcare space. It centered equity, as the slide on the right showed, And if we would move to the next slide, you'll see that I have a summary of what's in that report. Equity is centered. We have 5 domains and 39 recommendations. We also note that implicit bias training and policy are prioritized, and there need to be not just long-term changes, but we have short-term ones that we need to start working on immediately. Next slide. So, why are we doing this in this summit? What I'm really in summarizing the post-pandemic recovery report, which I encourage you to take a look at, is to say that not will we've finished all of that work, but we really need to focus on the 2 remaining legs of the stool, the social and structural determinants of health and the structural and institutional racism. And that is why this summit is really in collaboration with my colleague, Dr. Amber Hewitt of the Office for Racial Equity. We are modeling the kind of work of collaboration and connection so that we can get the work done as we need to do. Next slide. As a quick summary, our agenda is such that we are going to take this roadmap, as we said. We're going to engage our GPS with Daniel Dawes. We're going to have a plenary session, which is about packing our bags and talking about the DC experience. We're going to think about how health equity, after the report was published, has generated a paradigm shift in the district. We're thinking also about what we can learn from the pandemic response and its insights. And then finally, later on this afternoon, we're going to talk about what the future of equity in the district, both in terms of health equity as well as racial equity. And then we'll do a closing. Next slide. So, quick housekeeping. Please join the conversation because your insights are important. If you want to tweet or join us, please use the Run the World platform. For a full summit agenda and the bios of all of the speakers and panelists, please use the Run the World web platform. And in case you miss it, all the summit sessions will be posted on YouTube after this event. More importantly, we want you to stay engaged with DC Health and engage with dchealthequity.com to learn more.